stress disorder. What is that? I really like to reconceptualize that as not as a disorder, but actually, if I can, I know, DSM hasn't allowed us to do that just yet, but I like to look at this as post-traumatic stress response, because it actually is a response to a very unusual incident that takes place in a person's life that if you or I had experienced that kind of experience would likely have very difficult symptoms as well. So let's go on to the next slide. PTSD in essence is an anxiety disorder. It's a disorder, got 5 more minutes. Thank you so much for the graciousness. I will make this really quick. So post-traumatic stress disorder is an anxiety disorder that once exposed to a traumatic event, it raises feelings of intense fear and helplessness, and it prevents a person from interacting and engaging with the world in regular ways. And I'm going to pass this on to Dr. Lori Katz to kind of make sure that a lot of these things related to PTSD are clarified, because I've got just a few minutes. So I'm not going to go into all of the different categorical symptoms of PTSD, but it can be a very debilitating disorder because, or response, because it prevents people from interacting with people and feeling safe in their environment. And many times it causes them to isolate and alienate themselves, causes intrusive nightmares, intrusive thoughts during the day, and re-experiencing the traumatic experience. These are some of the other potential problems that go along many times with post-traumatic stress disorder, major depressive disorder, different anxiety disorders. We can go on to the next slide, please. Chronic medical problems, homelessness, and problems with joblessness. Lastly, don't cry for me. Once again, for women of the United States Armed Forces, they don't want our pity. What they want is support. What they want is education. And what they want are accurate resources. And we get accurate resources because of forums and discussions just like this. And we're able to connect and collaborate with one another. And as I end in just the last few minutes, I want to share the end result of Tiffany, the woman that I shared with earlier. We worked together for about 2 years, almost 2 years. And by the end of the treatment, she'd gone back to work. She was engaged with this gentleman that she was in relationship with. She was demonstrating an ability to assert herself at work, meaning being able to set safe boundaries and limits for herself. She was able to take breaks from work. When she felt overstressed, she was able to identify with internal experiences. Okay, now I need to back off. Now I need to assert myself. She had not experienced a panic attack that lasted like they had previously lasted in over 2.5, 3 months, and was doing very, very well, and felt that she had a future because there was hope. And that hope came from an experience that I believe that all of these women, we need to acknowledge very strongly, even in the treatment, and I'm going to end here, that there is something inside of these women. There's something inside of us all, but we're talking about women in the military, that is stronger than words can actually describe. Sometimes they need help. And that is the process of treatment. That is the process of recovery. And I'm so grateful to be here and to share that. I hope that this was helpful, and I appreciate your time and your attention.